What embryology topics appear on USMLE Step 1? If you are preparing for the United States medical licensing examination, Step 1, and wondering about the embryology topics you will encounter, you are in the right place. Let's break down what you need to know. Embryology is a key component of the foundational basic sciences tested on the United States medical licensing examination, Step 1. Typically, it represents about 10 to 20% of the anatomy and embryology section. The focus is on understanding normal human development, congenital anomalies, and how these relate to clinical conditions. One of the primary topics is germ layer derivatives and early embryonic development. You will need to know how the three germ layers, ectoderm, mesoderm, and endoderm, form and differentiate. Key processes like fertilization, cleavage, blastocyst formation, and implantation are also essential. Understanding gastrulation and the formation of the trilaminar embryo is crucial, along with neurulation and neural tube formation. Be aware of timing and defects such as spina bifida. Next, organogenesis and the development of major organ systems are vital. For the cardiovascular system, you should know about heart tube formation, septation of chambers, and common congenital heart defects like tetralogy of Fallot and ventricular septal defects. In the respiratory system, focus on lung bud formation and branching morphogenesis. For the gastrointestinal system, you will need to understand the development of the foregut, midgut, and hindgut, as well as the rotation and fixation of intestines. Common congenital anomalies such as malrotation and atresias are also tested. The renal and urinary system includes the development of pronephros, mesonephros, and metanephros, along with common malformations like horseshoe kidney. In the reproductive system, differentiation of indifferent gonads and the development of male and female genitalia are important. The nervous system covers neural tube closure, brain vesicle formation, and neural crest derivatives. Lastly, for the musculoskeletal system, you should know about somite formation and how they differentiate into sclerotome, myotome, and dermatome. Another area of focus is placental and fetal membrane development. This includes the formation and function of the placenta, chorion, amnion, and yolk sac. Understanding maternal-fetal circulation and related pathologies is also necessary. Timing of developmental milestones is another key topic. Recognizing critical periods, especially during the embryonic period when organogenesis occurs, is essential. This is when susceptibility to teratogens is highest, so knowing when specific structures form and when defects can arise is crucial. Finally, clinical correlations and congenital anomalies are often tested. You should be familiar with teratogenic effects and their embryologic basis, as well as common congenital malformations and syndromes linked to developmental errors. Interpreting clinical scenarios related to embryology, including prenatal diagnosis and ultrasound findings, is also important. In practical terms, mastering embryology for Step 1 means understanding both normal developmental processes and how deviations can lead to disease. Questions often requiring applying this knowledge to clinical vignettes or identifying embryologic origins of congenital defects. The exam integrates embryology with gross anatomy, pathology, and physiology, emphasizing problem-solving rather than rote memorization. Focusing on high-yield embryology topics tied to organ systems and clinical relevance is essential for success on Step 1.